So let's go ahead and bring in ABC News medical contributor Dr. Alok Patel to break this all down, along with other health issues that we've been following this week in this week's Health Roundup. So Dr. Patel, thank you so much for being here. Let's talk about fluoride first, because many cities throughout the years have removed fluoride from their water supply, but this is the first state to work to remove it. Fluoride has long been proven to prevent cavities. So what effect could this have on dental hygiene in the state long term? And what, if any, health risks are involved with ingesting it in our water?
Gio, this could absolutely disproportionately affect people living in rural or underserved communities who don't have readily access to dental care or oral health specialists, especially children. Now, even if we're just looking at Utah itself, data from the University of Utah shows us that about 60% of Utah counties are health professional shortage areas, meaning these are children who don't have dentists and may not have follow-up care. And fluoride, we know, is a low-cost, low-risk intervention to protect those teeth against dental caries or cavities. And people often forget that cavities are a very serious chronic illness of childhood that can affect everything from sleep to education and create some long down-term issues. There's a lot of misinformation out there about fluoride. And the reality is that the studies showing low IQ are inconclusive and mostly done in non-U.S. populations. So science first.
It is so interesting to follow. Let's go ahead and talk about the measles now, Dr. Patel, because there's so much happening there. According to the latest CDC data, there are nearly 500 cases of measles. 400 of those are in Texas alone. So how can people protect themselves from catching measles? And what should you do if you don't know if you're vaccinated or you're not? Can you get the shot just in case?
Gio, I can tell by your question that there is so much happening right now. We are far surpassing cases we had last year. It's important for people to realize that 97% of cases in the measles right now are in unvaccinated individuals. So vaccines are by far the most proven way to protect yourself against measles with lifelong coverage. If you don't know your status, talk to a healthcare professional. If you've been exposed and you're unsure, talk to a healthcare professional. We saw that from that case from the Amtrak just how contagious measles is. This virus can survive on services for hours.
4 hours, okay. And thousands of employees are expected to be laid off from Health and Human Services next week. Overnight, ABC News did learn that the FDA's top vaccine official who played a crucial role in the development of the COVID-19 vaccines during the pandemic, he's actually resigned. As a doctor, what are the impacts that you and your colleagues are preparing for right now?
Gio, the impacts are widespread and potentially starting from even local public health efforts to scientific progress to preparedness for the next pandemic. We don't know yet what the downstream effect of the 20,000 cuts to HHS employees, but also the billions of dollars that have been cut, what that could really have. I'm hearing reports about people losing their NIH-funded grants to study gene therapy, mental health, addiction, even pediatric cancer research. Peter Marks, as you mentioned, who resigned, put out a statement saying that we have prioritized misinformation as opposed to scientific ingenuity. So this is a very big warning call. It's not just about cutting money to save waste. We're talking about scientific ingenuity and public health for all.
All right, Dr. Alok Patel, we're so grateful that you're here to break this all down, because obviously there are so many. Oh, thank you, my man. So many medical headlines, so we appreciate you. Thank you.